Okay, so let's talk about the communication cluster of the OSCE today. So what is it exactly?
Yes, so there is this cluster which is effective communication, and you have to pass that cluster, as I've already told everyone in my previous video. But before discussing that, I want to discuss what is expected out of a communication. When we say communication, what exactly is it? So in simple language, it is like a process in which you receive an information and then you process it and then you convey or send the information to a person. Yeah.
And how does it apply in the OSCE perspective?
Yes. So, for example, I just say that there is this cluster on the OSCE day, which is known as diagnosis and management cluster. Okay. If you want to apply this effective communication in this cluster, what I would say is that they have given you some information already, okay, that's on the screen.
So you are reading that information?
Yes, absolutely. Then what I would say is you have to gather some information from the patient as well,
Right.
okay? And you have to make sure that the information that's given is correct. So you have to confirm with the patient about the information that's already there.
Right.
Okay, so you are getting the information, reading the information that's there, you are getting the information from the patient, and then you're confirming all the information from the patient.
Right. So what you're saying is listening forms an important part as well.
Yes, absolutely.
Right.
After that, you have to process the information. So you're doing it at the same time while you're gathering the information, okay, and confirming it. You're processing it in your head, coming to a conclusion, which is actually diagnosis, okay. After that, you have to convey the information to the patient.
Right.
Okay, so you have to convey, you have to tell the patient what is the diagnosis. Okay, but it should be in such a way that the patient can understand you. So when you are conveying your message or information, you should ask the patient whether he or she is getting you or not. That is also an important part. So you have to do it in between.
Right.
Okay.
And do you have to have very good English, and do you need to speak very fluently to pass the communication cluster?
No, I don't think so. It should be simple. You don't have to use very fancy English or very fluently. Don't do this thing that at one point you're speaking really fast.
Right.
And then when you're not, you're not getting words, or you're not able to make sentences, then you are really slow and you're thinking in your head. So make a pace which is actually very suitable for you to convey your message, as well as it is good for the patient at which pace he or she can understand you.
Right. And some people think of it as a viva because it's actually the examiner who is sitting in front of you.
Yeah.
So should you give it as a viva?
No, not at all. Yeah. So as I said previously in my videos, that just imagine yourself in a dental clinic and a patient is coming to you. How are you going to communicate with that patient? Of course, it remains in our head that the person sitting in front of us is the examiner. Okay, but you have to remove that concept from your head once you start communicating in the OSCE station.
So which means your body language and the way you speak and the way you explain things should be like that?
Absolutely, because they are marking you, I think, on each and every criteria. Like these are also the criteria that they are marking you on.
And what about the use of the technical words?
If you can make use of simple words rather than technical, that would be great, because technical words are for yourself. You are getting those, you are a professional, but a layman, or if a patient is coming without having any medicine or dentistry background, how is she gonna understand you? So you can, of course, when you're making a diagnosis, you have to tell what the diagnosis is. You have to tell the name exactly, okay? For example, if you have made a diagnosis of primary herpetic gingivitis, you have to say this, but then you have to explain in very simple and clear way what exactly is it.
Right.
Yeah.
So if I have to circle back again in terms of what is the effective communication that qualifies you for the OSCE communication round,
Yeah.
what are the main components of it?
The main components are just three, I would say. That how are you receiving the information? Then you have to process it at the same time. Then you have to convey the information.
So
to the
in terms
patient.
of receiving, you mentioned reading the question.
Reading and listening to the patient.
Right.
Absolutely. Yeah.
And then also listening to his words.
Listening to his words, listening to the gaps in between, the non-verbal portion.
Right.
Like if a patient is coming in pain, you should show empathy because he already said that he's in pain. Sometimes they behave like that, I'm in so much pain, so they are saying, or they are telling you by all those gestures. Okay, so you have to get that. If a patient is coming irritated, okay, then he's already fuzzy and everything, then you have to get that in mind, that how am I going to deal with this patient. So these are like the gestures that you have to read as well.
Right. So we talked about reading the question, listening to the patient, and then if you still have some doubts or gaps,
then you can clear it with the patient.
So asking the questions.
Yeah, absolutely. Yeah.
Right. So that's the receiving part.
Yeah.
Now, in terms of processing that information, what is the process of that?
So it all depends on your knowledge, your experience. Okay. So you are getting information from the screen, from the patient, and then the patient behavior and everything. And at the same time, you're processing it. When I'm saying processing it, you are preparing yourself. Now, what am I gonna say to the patient? How I'm gonna tell the patient? How am I gonna calm the patient if he or she is fuzzy or irritated or whatever?
Right. And it's too much to do in the short time. So how can a person improve that?
It comes with the practice. It just comes with the practice. So you do different cases, and then you learn while you practice.
Right.
Yeah.
So once you have processed the information, then you start conveying the information, as you said, by speaking.
Yeah, absolutely. By speaking, by empathizing, by showing sympathy, and then just showing them that you are getting them,
right,
and you are there to help them. Okay. And then telling them each and every part of it.
Right.
It is like it is ethically wrong if you're not giving any information to the patient.
Right.
Okay, that's missing. Yeah.
And is it okay to just convey and speak all the information, or is it also important to confirm and cross-check as well?
Yes, you have to confirm, you have to cross-check, and sometimes you have to take consent as well.
Thank you.